Coming up on Health Watch, we're going to introduce you to a remarkable circle of care. Hello, I'm Terrence Affer Anderson, and this is Health Watch. Before we get started on today's show, I want to take a moment to acknowledge and extend a hearty welcome to some new viewers of Health Watch. Since the last edition of the show, we've picked up new viewers from 7 additional stations throughout greater metropolitan Hampton Roads. This includes the cities of Virginia Beach, Chesapeake, Portsmouth, Suffolk, and Williamsburg, as well as James City and Gloucester counties. Welcome. And I promise to bring you the same kind of insightful, engaging health education information that our regular viewers have come to expect. That said, let's get into today's show. Last January, we brought you a very special hour-long edition of Health Watch. Following a moving discussion we had on family caregiving last November, we broke new ground and had a live studio audience. It featured family caregivers from all walks of life, as well as professionals who provide services to family caregivers and those who benefit from their care. The program also featured an expert panel of professionals who were themselves immersed in the arena of family caregiving. What ensued was very insightful, lively, and heartfelt discourse on an important healthcare issue that impacts Americans all across the entire spectrum of our society. We're going to continue that discussion today and share information on an event that if you are a family caregiver, we'll be certain you want to attend. But first, let me welcome my guest today. Join me, please, in welcoming back to Health Watch, Carol LaFauci. Carol is a geriatric nurse practitioner and is a member of the National Family Caregivers Association. Having also cared for both her mother and her father, Carol is well acquainted with the family caregiver experience. I also want to welcome a good friend, Brenda Cobb, a medical social worker and community liaison with Interim Home Care and Hospice. Brenda was in our studio audience for that groundbreaking edition of Health Watch. She also is on the planning committee for the special event that I mentioned at the top of the show. My third guest, also returning for today's show, is Dr. Christiane Fowler. Dr. Fowler is a member of the faculty of the Old Dominion University School of Nursing and is a gerontological nurse practitioner. She earned her doctorate in that same field. Welcome to Health Watch, ladies. Welcome back to Health Watch. And I knew I was going to get that screwed up, gerontological.
Thank you, Terrence.
So we're going to give some information at the end of the show about this event that I just mentioned. But I'd like to start off with that information as well. And that is the Circle of Care Across the Lifespan Family Caregiving Conference. Carol, when is the conference? Where is it? And why are we doing it? I'll ask you why again.
Okay. The conference is November 17th, 2012. Starts from 9 a.m. to 1 p.m. Registration is at 8 a.m. It's going to be located at Norfolk's main Public Health Center, which is 830 Southampton Boulevard. And there'll be on-site registration starting at 8.
Okay. And why are we doing this? Why are we doing this?
We're doing this because nationally, during any given time of the year, more than 29% of the population of the United States, that's 65 million people, care for chronically ill, disabled, or aging family members or a friend. The value of the services family caregivers provide for free when caring for older adults is estimated to be $375 billion a year. 78% of adults living in communities in need of long-term care depend on family and friends as their only source of help.
Brenda, we're going to have a couple of general sessions, plenary sessions. What are the topics and who are those people that are presenting?
Well, our opening general session speaker will be Dr. Karen Armstrong, a clinical psychologist with Hampton Roads Behavioral Health. Dr. Armstrong will speak on caregiver burnout, and then we'll have our keynote address providing family care across the lifespan, what we are calling the Circle of Care, will be delivered by Dr. Paula Ravage, a professor of pathology and anatomy, the Department of Internal Medicine, Division of Geriatrics, Eastern Virginia Medical School.
Okay. And we also, Christiane, are going to have some concurrent breakout sessions. Why don't you tell us a little bit about those?
Yeah, I think the breakout topics are going to be really good and very important for our caregivers. It's going to include estate planning and financial planning, palliative care, and emergency preparedness, and response for people who care for people with disabilities. We're also going to have a local attorney that's going to be there, Geneva Perry of the McDermott Ward Law Firm, and she'll be conducting the session on financial planning. Also, Gary Talley, an Outreach and Community Service Programs Manager with the Virginia Department for the Deaf and Hard of Hearing, will be conducting the session on emergency preparedness. And we're going to have the session on palliative care. We're still trying to finalize the presenter for that, but that'll be a great topic to be covered.
Yeah, that's going to be some exciting breakout sessions as well as the plenary sessions. Now, the Virginia Council of Nursing Practitioners is going to be providing our lunch for today. And we want to thank you again for making that happen.
Sure.
But during the lunch, we're going to have a rather novel thing that we're all very excited about, where we're going to have folks that are going to get up and do some 5-minute testimonials. What can you tell us about that?
Well, I think what we're going to do is we're going to have some people who have been in the caregiving role. Hopefully people, we've contacted some people that have had different caregiving experiences, meaning some may be caring for an aging parent, some may be caring for a child, some may be caring for a friend or something like that. But we're going to have a variety of people that are able to speak on the panel about their caregiving experience. And we hope that the panel discussion will kind of warm up the crowd a little bit, and maybe the people in the audience will be able to ask some questions, and maybe the panel's been able to touch on some things that they're particularly interested in. So I think that'll be really, really exciting and give an opportunity for a lot of give and take.
Yeah, I think that is, in fact, going to be really, very exciting. I'm sure that there are going to be some family caregivers in attendance that are going to, want to contribute to that conversation. Brenda, we are certainly targeting family caregivers, individuals, but we are in anticipation of looking for agencies to attend as well. What type of agencies do you think will come out for this event?
Well, I was thinking about like home health agencies, also durable medical equipment. We also going to speak with someone at Senior Services, at Children's Services Network, if we could find someone from there, which we're looking to do. Also, we're going to have someone from the Alzheimer's Association. So we want to try and cover the gamut, because caregiving doesn't start just at one place, but it is across the lifespan.
Absolutely. Ladies, let's talk now about our own personal experiences with caregiving. I mentioned in the 2 previous editions of the show that we dealt with this particular topic. I mentioned that my sister provided the principal care for my father, who passed in 1999, and is doing the same for my mother now. But we all have some exposure to that. And I mentioned, Carol, that you care for both your mother and your father. Can you tell us a little bit about that experience?
Of course. I have a little bit different story than your typical caregiver. I knew my father was becoming ill, progressively ill. I was a critical care nurse for about 10 years, and then for about 2.5 years, I worked University of California, San Diego's heart transplant center with patients who were end-stage heart failure. My father was slowly dying of heart failure. So I had the background, the training, and all experience, and I could watch my father's symptoms decline, and I could predict when he would need my care. So about 2 years before he passed, he moved out to Norfolk, and we found him an apartment just 4 blocks from where we lived, across the street from EVMS. I had everything set up. I thought, okay, I can handle this. And I have, I'm one of 5 children, and my brother and sisters thought this is good, because I would know when anything went wrong, I would know what to do. They were close to the hospital, not a problem. And the thing that surprised me the most was that I kept thinking I was on top of things. I knew the doctors to call, but as he became more and more sick, I became more and more burnt out. Things that I thought should happen didn't happen. Home health nurse, when we brought home people, my father didn't like them, this happened, that happened, things that I couldn't predict. And that threw me. I thought I was, knew it all, it was going to be perfect. It was going to be the perfect type of death I had predicted, because I knew what was going to happen. I thought my mother was coming along, understood what was happening. She did not. She was in denial up until the very end, which created more stress for me. So it's just one thing after another that I did not expect to happen, even though I thought I was on top of things.
So it can be a whole new ball of wax.
Yes.
Yeah. Brenda, what about your experience? Do you have any personal experience? I know that with interim home care and hospice, you probably have some experience, but do you have any personal experiences as well?
I do. One thing I'd like to say is that people don't raise their hand and say, I believe I want to be a caregiver. It's something that just happens and they just stepped up to the plate. I actually had the experience of helping to care for my father-in-law. And everything that you know as a professional sometimes goes out the window. And so I had to take off the professional hat and actually be a daughter-in-law. And I think sometimes when we are caregivers, we feel like we have to wear all these hats, and that's not necessarily so. We try to encourage people to wear the hat that you need to for the position that you're handling.
That's interesting that you took off the professional hat to become a daughter-in-law.
Yeah.
Why did that transpire? What was the distinction?
Well, as a professional, you come in and you know A, B, and C is supposed to happen, but really, you need to allow yourself to grieve and to do what you need to do as a daughter-in-law, as a daughter or a sister, whomever. But as a professional, you have this facade. You know, this is how we're going to get it done, 1, 2, 3. But sometimes it's not 1, 2, 3. It could be 2, 3, 4. I could go backwards, and so allow myself to go where I needed to go in order to get the job done.
And Christiane, your own experience?
Well, I've had a couple of different experiences. When I was younger, in my early to mid-20s, I was the caregiver for my grandmother, who actually lived in a nursing home in the school where I was attending nursing school. So she was in the nursing home, but I still considered myself a caregiver because I was there every day. I helped feed her dinner. I helped get her teeth cleaned at night. I helped get her nightgown on, put her into bed, and I did that pretty much every day. And then just a few years ago, I've had the experience of caring for my stepmother, who actually came to this area and lived in her own home. And so I had the experience of caring for somebody in their own home. And to sort of echo what Carol said, it's very different to care for somebody, you know, in a home setting. I had to worry about finding somebody to be there during the day while I was at work. And again, a similar circumstance where she didn't like the person that was there, and it was a lot of these, you know, extraneous stresses that were on you. You know, even though this is what I did day in and day out every day, it's very different to do it for a family member. And I know Brenda and I have talked in the past. Brenda's been a friend of mine and a great support for many years. And I just dawned on me one day, I told Brenda, I said, I didn't choose to parent my parent. I mean, you feel like you're somehow having to take control of things and do things for them, and it's a totally different role, and it's very stressful because if she was disapproving of something I did, even though she clearly needed much help, physical help, if she disapproved of what I was doing, it was still my mother disapproving of what I was doing.
Understood.
So it can be extremely stressful.
You know, and I think that's probably why it's very appropriate that the first session that we had, the first plenary session, the opening session, does in fact deal with caregiver burnout, because you can see that. You know, I watch my sister, and you know, whenever she calls and she needs a break, I'm there. You know what I'm saying? Because you can see the kind of stress the toll that it in fact takes. Now, a lot of, I think the overwhelming majority of the people that provide family care are caring for an adult relative. Can you give us some insight on that?
Oh, sure. 36% of family caregivers care for a parent. 7 out of 10 caregivers are caring for a loved one over 50 years. 1.4 million children ages 8 to 18 provide care for an adult relative. 72% of these children are caring for a parent or grandparent. 64% live in the same household. The typical family caregiver is a 49-year-old woman caring for her widowed mother, who's 69 years old and does not live with her. She is married and employed.
The majority of caregivers are women. What can you tell us about that experience, Brenda?
Well, approximately 66% of the family caregivers are women. So more than 37% of female caregivers have children or grandchildren under the age of 18 years old living with them. Women who are family caregivers are 2.5 times more likely than non-caregivers to live in poverty, and 5 times more likely to receive supplemental security income.
I wonder why, and all of you have provided care. Why is it that women are the predominant caregivers? What do you think? I know this is off script. I tend to do
I think
that.
it's societal expectation.
It's
Societal expectation.
Okay,
Society
okay.
expects the daughter, the sister, more the female role, the wife. I know when I was growing up, my father is very old school Italian, and he was expecting his daughters to care for him when he became older. And we knew that was our job. We were growing up. You take care of your parents. I also think, like myself, I was not working at that time. I had 2 small children. I had a baby and a 3-year-old when my father came to live with us. So I was home all day, well, with children. But I was available, whereas my husband was
Which is a
working.
job in itself,
right? Yes.
right.
But I was home and able to take my dad to his various appointments, run to pharmacy, take care of whatever, go do the grocery shopping, whatever else needed to be done. And I also think, society puts too much emphasis on the husband working, the male working, whereas I think a little bit less so on the woman, who's seen more as the nurturing type, the one to be up at 2 in the morning when there was a problem, as you would with your own children.
And women are cast more as nurturers than men are. But it does, in fact, take a toll. What can you tell us, Christiane, about the kind of toll that does, in fact, take on people that are family caregivers? It's a job, but there's financial tolls as well.
Well, it can be very stressful, but I do want to point out that caregiving does have its positive side too. A lot of people do feel very good about what they do. They feel very satisfied. They feel that they're doing a good thing. So there are some positive aspects to caregiving, but a lot of times, unfortunately, it can be overwhelming rather quickly. And the average is about 20 hours of caregiving per week for the people that are providing care, and that's part-time work. That's a lot, and that's the direct hands-on care. And more than 13% are actually providing up to 40 hours a week. Wow. So that's a lot of work.
40 hours a week.
That's
that
a
is
lot
a
of
job.
work.
Yeah.
And one thing I want to be sure to mention. Carol went over some statistics of the cost of caregiving for the people that are caring for loved ones at home.
Yes.
I want to be sure that people understand that cost is actually, the money spent is actually a cost savings to our healthcare system.
Yes.
Because they're actually doing the work, and their work is valued. And if they weren't doing the work, the only other place for these people who need this hands-on care would be some form of a nursing home or assisted living or something like that. So that would be a cost to the healthcare system. And also, we need not forget that I'm a gerontological nurse practitioner, so I'm always thinking geriatrics. But there's a very high percentage, up to 14% of the caregiving population, that are caring for a child. So that's that's very important for all of us to remember, and we're hoping to capture that population and address their needs when we have the conference in November.
I want to come back to that a little bit later, as we're talking about folks that provide caregiving to children. And I'm so glad that you make sure that we brought in that caregiving does have a lot of positive aspects as well, in terms of relationships between the caregiver and the person receiving care, and also the remarkable benefit that it provides to the American healthcare system.
We really need to support the caregivers.
Absolutely.
Because they're saving our economy money.
Indeed.
So we really need to find ways to support them emotionally, financially, physically. We need to do a much better job.
That makes for a great segue into our discussion about the National Family Caregiver Association. What can you tell us about the NFCA?
NFCA, the mission is, the mission of the National Family Caregivers Association is to empower family caregivers to act on their benefit. We're looking for them to be able to bring down the barriers that's typically between their health and well-being. We need them to have to feel strengthened by what we provide for them online and what we provide for them locally, to go to the doctors, go to the healthcare people that they need to get what they need for their loved one.
And the Family Caregivers Association also has some core carrying everyday messages?
Oh yes, the four basic beliefs that we have. The first one is believe in yourself. This means to feel confident in what you can do and cannot do. Too many people will say, okay, I can, this is my husband, I will do everything that needs to be done, I am his wife. They will get to themselves a position where maybe the care is too heavy, like lifting and transferring is too heavy for them.
Right.
They may get confused with the medications, and maybe the changing is too much for them. They may not have time to go to the grocery store like they need to. And people have to be able to be confident in themselves, say, okay, this is what I can do and this is what I cannot do. And there's also be able to believe in yourself that you can do it with a little education. Maybe you can learn how to do the medications, you can learn to do the dressing change. So just have confidence in yourself that there is help for you. The next one is protect yourself. So many times people let their own selves go. I know when my father was ill, my mother became very ill shortly after he passed because for so long she was putting off her own health needs. She didn't tell us about a cut in her leg that became infected and ended up in the hospital for 7 weeks late after his death. She just let things go. She wasn't eating. She wasn't sleeping very well. So when he did pass, she finally just, like I said, ended up in the hospital for 7 weeks because she kind of let herself go. But that's very common. And people who have maybe more of a chronic long-term care picture they're looking at, maybe several years they will be with their loved one, it can cause a lot of problems because if they're at a position where they're not taking care of themselves, they too may end up in the hospital. And then who's going to be there for their caregiver, for their loved one, to help care for the loved one?
Now, you guys also have something called CCAN, the Caregiver Community Action Network.
Right.
What is that?
CCAN is this is over 110 members of the National Family Caregivers Association. I started out as a member at the National Family Caregivers Association because I heard one of the co-founders, Susan Minutes, speak about it, and I was so impressed and so moved by what she said. I said, I've got to belong to that organization. And then they approached me about becoming what's called a community care network agency. Community.
Caregiver Community Action Network. Right.
And what this is for over 110 members over in 30 states. And what we do, like the state of Virginia there's 4 of us, and we will speak to the press, do things like this. We are there for the local people. If people want us locally, if someone in the Norfolk area had problems and they needed some advice, they need to know where to go, what our thoughts were on different things, we're there to help them for that. We're also involve anything more regionally that's involved. If there's anything going on in like Virginia State Legislature, we'd be involved with that.
Okay.
And just to know more locally, so bringing the message of National Family Caregiver Association on a local level.
Brenda, Interim Home Care and Hospice, give us a portrait of what that agency is all about.
Well, what they do is actually, it is across the lifespan as well, because we have personal care, where people can come in and sit, companionship, help with ADLs, activities of daily living. We also have home health, which is skilled needs. So if a person's been in the hospital and needs some skilled needs done, we can go in and do that. And then we look at end-of-life care, which is very important and very near and dear to me because how we take care of people at the end of their lives really truly make a difference. And so we can actually care for the patient across the gamut.
Okay. Ladies, we're actually about to run out of time, if you can believe it. So I want to make sure we give some contact information for each of your agencies. For the National Family Caregivers Association, how can folks reach it?
National Family Caregiver Association is located 10400 Connecticut Avenue, Suite 500, Kensington, Maryland. Zip code is 20895. Toll-free number is 1-800-896-3650. The local phone number is 301-942-6430. Fax 301-942-2302. I would recommend the website. It's very informative, and also they have people that check it frequently and get back with any questions you may have. That's www.nfcacares.org.
Okay, and Brenda, Interim Home Care and Hospice?
The address is 516 South Independence Boulevard, Suite 106, Virginia Beach, Virginia, 23452. The phone number is 757-466-1401, and the web address is www.interimhealthcare.com. interimhealthcare.com.
Okay. And Christiane, for those that are interested in perhaps going into nursing, can you give us some information for the ODU School of Nursing?
Yes, the ODU School of Nursing, of course, is here in Norfolk, Virginia. The best contact is email at oduson@odu.edu. The phone number is 757-683-4297. And also, if you go to the web, www.odu.edu, you can click on academics and look at nursing through the health sciences.
Fantastic. Ladies, I'm really looking forward to this event. And I want to thank you so very much for coming on to the show today to tell our viewers, our new viewers around Hampton Roads, about this very, very important event. Again, thank you so very much.
You're welcome.
Remember, November is National Family Caregivers Association Month, and in recognition of this very special observance, my guest and I have prepared an event just for you, the Circle of Care Across the Lifespan Family Caregivers Conference. The event takes place on November 17th from 9 a.m. to 1 p.m. at the Norfolk Public Health Center, 830 Southampton Avenue. That's at the intersection of Bremerton and Colley Avenues in Norfolk, 23510. On-site registration is from 8 a.m. to 9 a.m. But if you'd like to register in advance, or if you simply would like more information, please give me a call at 757-683-8836. You can also email me, of course, at terrence.afford-anderson@vdh.virginia.gov. Of course, you can also reach me directly with that same contact information. And for our new viewers in Virginia Beach, Chesapeake, Portsmouth, Suffolk, Williamsburg, and James City and Gloucester counties, you can see previous editions of Health Watch online at www.norfolk.gov/TV48/health_watch.asp. For the Norfolk Department of Public Health, I'm Terrence Affer Anderson, and this has been Health Watch.